So Gisela, I just want to pronounce your name correctly. Is it Gisela Escobedo?
Yes, ma'am.
Okay, thank you.
Yes, you're welcome.
So just to be clear, for those that want to hear the proceedings in Spanish, they should look for a button at the bottom row of the screen.
Right. Gisela is going to kind of go over all of that and let people know what they need to do if they want to hear it in Spanish.
Okay, great. Thank you.
Fortunately, she's done this before, so she knows. This is my first try.
What a hero.
We'll be fine. We'll be fine.
Hey, Gisela, did you help us on those town halls we did back in the winter and the spring? Does that ring any bell? We had somebody helping us.
Sir, I think I do like 3 or 4 meetings a day, so I'm sorry if I don't remember.
Yeah, no problem.
Yes, but I mean, we do a lot. We're really into the community.
Great, that's great.
Mm-hmm. Get down. Get down.
Okay, it's 4:30. Not everybody's here, but hopefully after we do the roll call, most everyone will join us. I wanted to start right on time. Before I begin, I'd like to thank Rene Brockman, who has arranged for a Spanish language interpreter to be with us, translate our proceedings. Gisela, there you are, Escobedo, will be with us, and Gisela will explain a little bit about the process before we start our meeting. Gisela, please.
Thank you very much. Hello, everyone. My name is Gisela Escobedo, and I'm here with Ariana Mendoza. Both of us are with the Community Language Co-op, and we want to say thank you for giving us the opportunity to practice language justice. Thank you for giving an opportunity where we can participate and engage in the language of our hearts, the language that we feel most comfortable in, or the language that we practice at home. So we're going to be using simultaneous interpretation in English and Spanish. So when I finish saying this in Spanish, we will turn on interpretation. You will see a globe icon on the bottom of your bar that says interpretation. If you're not fully bilingual, I ask that you select your preferred language. If it's English, English, Spanish, Spanish. And if you're bilingual, feel free to listen to everyone in their language. If you're joining us with a phone or a tablet today, it has 3 dots that says more. So you're gonna click on it, and also you're gonna select your preferred language. You can also mute original audio so you don't hear both languages at the same time. Hola, buenas tardes a todos. Mi nombre es Gisela Escobedo y estoy aquí con Ariana Mendoza. Juntos estamos aquí con la Community Language Co-op y estamos aquí porque los patrocinadores de este evento están comprometidos con la justicia del lenguaje. Nos están dando la oportunidad de participar en el idioma de nuestro corazón, en el idioma en que nos sentimos más cómodos o el idioma en el que nos practicamos en casa. Vamos a estar usando la interpretación simultánea para crear este espacio. Así que cuando termine de decir esto, vamos a activar interpretación. Usted va a ver un icono de globo en la barra de abajo de su pantalla que dice interpretación. Si no eres bilingüe, te pido que le des un clic ahí y selecciones tu idioma preferido. Si es inglés, inglés, español, español, pero si eres bilingüe, pues puedes escuchar a todos en su idioma. Y si hoy estás en un teléfono o una tableta, vienen 3 puntitos que dicen más o more. Le das un clic ahí y puedes seleccionar tu idioma preferido. Te recomiendo que silencies el audio original para que no escuches ambos idiomas al mismo tiempo. Si tienes alguna pregunta, estamos en el chat. If you have any questions, we're gonna be on the chat. We're gonna be checking both channels. So thank you very much. You can go ahead and turn on interpretation.
Thank you, Gisela, and welcome. Renee, could you do the roll call, please?
Yes. After I call your name, please state present. Representing Adams County on the Board of Health, Julie Mollica. Rosanna Reyes.
Present, sorry.
Okay, thanks, Julie. And I see Rosanna's here too.
Did you hear me? Oops, yeah.
Julie Shills.
Present.
Representing Arapahoe County on the Board of Health, Jan Brainerd.
Present.
Dr. Thomas Faywell. And Dr. Kaya Gallagher.
Present.
Renee, I think Tom said he would be joining us later. I think he's on an airplane.
That's my understanding too. All right, Tri-County Health Department Leadership, Michelle Askenazi, Director of Emergency Preparedness, Response, and Communicable Disease Surveillance.
Present.
Heather Baumgartner, Director of Community Health Promotion.
Present.
Lisa Bolstad, Administrative Assistant.
Present.
Jill Bonchinsky, Director of Nutrition.
Present.
And I'm Renee Brockman, Executive Assistant. Monique Didier, Director of Administration and Finance.
Present.
Dr. John Douglas, Executive Director.
Present.
Maine Furman, Director of Human Resources.
Present.
Penny Grandy, Director of Nursing.
Present.
Brian Holabasek, Director of Environmental Health.
Present.
Jennifer Ludwig, Deputy Director.
Present.
Dr. Kelly Weidenbach, Director of Planning and Information Management.
Present.
Roll call is complete.
Thank you. Did the Tri-County team want to introduce anyone who is also attending our meeting tonight? Michelle?
Great, thanks. I'd like to introduce 2 people. Tracy Anselmo, who you're familiar with. She is our COVID-19 Partnerships and Strategies Manager. And then also wanted to introduce for the first time, Joshua Vine. He is our new Safety and Security Specialist. You used to be familiar, I think, with Sheldon Irons, but now I'd like to welcome Joshua Vine to the team, who has extensive experience, and we're grateful to have him and his support. So wanted to make sure you got to meet him virtually.
Thank you.
I'll follow up with that. The Community Health Promotion Division also has a couple of new team members that we're very excited to introduce. I am going to pass it over to Heidi Fritz to make those introductions.
So we have a couple of new folks that we wanted to introduce to you all from our Healthy Beverage team within the Community Health Promotion Division. So we have Dina Sobel, who is joining us, and she is a dietetic intern graduate of ours at Tri-County. And I don't know if we have time for her to say a couple more words about her background. We also have Nadia Rendon, who is with us as a community organizer, and she has actually been working with Tri-County since the beginning of this year, but was working as a PEG staff person and has now transitioned over to be a Tri-County staff person. So we are very happy to have them joining us and hope that they may have a moment to introduce themselves, if that's okay.
That's fine. I'd welcome hearing from your staff and team.
Great. Dana, would you like to start?
Sure. So hi, nice to meet everybody. My name is Dana, and just a little bit about my background. I have experience in the nonprofit sector with 2 different AmeriCorps programs. And then I worked with Food Bank of the Rockies in Denver. And then I decided to pursue my master's in public health up at CSU in Fort Collins. So I focused mainly on public health nutrition. And then, like Heidi said, I had the opportunity to do my dietetic internship with Tri-County, which was really great. And my current role at Tri-County is a prevention and policy specialist. So I work half the time on healthy beverages on children's meals campaigns, and then half of my role is on the tobacco prevention team. And then just on a personal note, I'm originally from New Jersey, but I've been out in Colorado for about 8 years now. And I would say I'm a big live music enthusiast. So yeah, again, it's just great to meet all of you, and I'm excited to continue being part of the team and working with Tri-County.
Welcome.
Nadia.
Yes, hi everybody. So my name is Nadia Rendon, like Heidi said, and I'm a community organizer working on Healthy Beverages campaign, formerly in Aurora and now in Northland. And so I'm with Tri-County. I'm pretty new and I'm part-time, and I have another role. I'm the Spanish Services Coordinator with the Denver Public Library. And so I have experience working with diverse communities and of all ages. I love doing outreach and bringing information and services to people. And I speak Spanish fluently. I grew up in Mexico. And I love Colorado, and I love my dog. You can see it in the back.
Thank you.
Thank you.
Thank you. Welcome. Okay.
I mentioned that Angelia Baker is also a new team member with the Community Health Promotion Division. She is joining us from the University of Colorado and has extensive experience in community engagement and health equity, risk and protective factors. Unfortunately, she is ill today, so she is going to be joining us for an introduction next time.
Good to know. And then I think we have some panelists, but we can introduce them when we get to that point in the agenda, if that's okay. Okay, just a short reminder to the Board of Health, please either raise your hand or use the chat function if you would like to ask a question or make a comment. I have to scan across 2 screens, so be patient. If I don't see you right away, I'll keep looking, and Renee always helps me if I'm not paying enough attention. For those members of the public who are attending tonight, we encourage anyone who has questions to go to the Tri-County website, which has updated guidance documents as well as answers to frequently asked questions. The website also has pages dedicated to special topics, including vaccines and testing, and addresses issues that are specific to businesses and schools. If you cannot find the information you need, there are also Tri-County Health Department contact numbers listed on the website that you can use if you'd like to talk directly to a member of the Tri-County team. During our meeting tonight, any members of the public who would like to make a comment addressed to the Board of Health can use the question and answer function. And after our meeting, all of your comments will be compiled and shared with the Board of Health. So thank you. Moving on to our action items. Do I have a motion to approve the minutes from October 13th?
So moved.
Is there a second?
Second.
Any discussion? All in favor say aye.
Aye.
Anybody opposed? The motion carries. We also need to approve the minutes from October 14th. Is there a motion to approve the October 14th minutes?
So moved.
So moved.
Is there a second?
Second.
Any discussion? All in favor say aye. Aye.
Aye.
Anybody opposed? Thank you. Sounds like the motion carries. As our final action item today, the Board of Health needs to appoint a nominating committee to come up with a slate of officers who will be elected at our December meeting. Are there any volunteers among our Board of Health members to serve on that committee? Julie Shills. And Jan Brainerd. Committee is open to anybody else. If you would like to serve on that committee, be sure and let me know after the meeting. Okay, moving along to our information items. As a first information item, Kelly is going to give us an update on the Tri-County Health Department Public Health Improvement Plan, the Community Health Assessment, and where things stand with the Tri-County Strategic Plan. Just as a reminder, we are now midway through the 5-year Public Health Improvement Plan, which was initially approved in 2019. Over the past year, the Board of Health has heard presentations on each of the 4 priority areas within the Public Health Improvement Plan. Tonight, we'll be getting a broader overview on the various public health efforts that are underway. And by the way, Kelly, thank you to your team for that very comprehensive midterm update report that was included in our packet. So take it away, Kelly.
You're welcome, and thank you. So today I'm going to provide just a very brief overview of some of our planning efforts. The focus will largely be on the FIP and then sort of where we are moving from our current CHA process into some prioritization and planning for the future. We'll also touch upon very briefly just strategic plan and where we're at with that. And we will not be getting into a ton of detail around all of the accomplishments around the FIP work, which there are many. So if you haven't yet checked out that 45-page summary report, please do. And of course, we've heard from the FIP leads in each of the priority areas this year, and we plan on doing priority area focused presentations to the board next year as well. And I'm really here more to talk about kind of the process and what's required of us and what our next steps will be. Just some objectives today, just kind of brief you guys on the overall progress of the FIP and allow for any questions that you might have on that mid-year report that was included in the packet. Describe the intended use of the CHA, the 2021 CHA for prioritization of future work, which still a lot of ambiguity, but we do plan on using that as a planning tool, and then provide an update on strategic plan. I know we have some new board members that may not be fully familiar, weren't here when we developed these plans. So if you recall, the strategic plan and the public health improvement plan were designed to be complementary to one another. Our strategic plan was very internally focused, looking at operations and ways that we could help support the external work that is within our public health improvement plan, with those core and innovative public health services laying a foundation and also foundation in health equity. And just as a reminder of our requirements, the State Health Department requires, through the Colorado Public Health Act, this health assessment and planning both, they have laid out a phased process for local health departments to follow. And that process is called CHAPS, the Colorado Health Assessment and Planning System, which is 8 distinct phases. Right now, with the FIP, we're really in phase 7, which is implement, promote, and monitor that plan. And later you will see that we're actually doing multiple phases of CHAPS concurrently. But with the FIP itself, we developed it in 2019 and it was approved by the board in February of that year. And we're really in that phase where we're implementing, developing work plans, promoting and working with our partners and our community-based organizations, and then monitoring our progress and reporting on the progress. So this gives an overview of the original FIP priority areas, including access to mental and physical health care services, mental health, health and food, and our developmental goal of health and housing. And here you can see the goals underneath each of those areas. I will not read them to you. And later slides will get into some detail around some of the objectives. So just some key takeaways I want you all to know. There's been a tremendous amount of work accomplished on these FIP areas. It's hard to overstate the amount of work. When my team was putting together the progress report, the midterm report, We were just blown away by what's been accomplished, even with COVID and our agency having to divert resources and staff to the pandemic. There's just been a tremendous amount of work done, and I think that speaks to the FIP leads and those work groups underneath them and their commitment to working on these areas that are really focused on social determinants of health. The efforts around the FIP were really a collective effort by staff across all of our divisions or many programs, all of our divisions, and also collective efforts with our partners and engaged community-based organizations in Adams, Arapahoe, and Douglas counties. You have heard throughout the course of this year updates from each of the priority areas, and they've outlined some of the ways that the COVID pandemic has affected their work and ways that maybe their work has shifted based on new challenges and new barriers that the pandemic brought to us. So just want to reiterate how significant of an impact that was, but the work continued to move forward. I also want to just highlight the fact that the work plan, so we have the original FIP plan, which is in writing and is published on our website, which outlines the priority areas, the goals and objectives. But each of those work groups have worked on operational work plans around how they will implement those goals and objectives. And those work plans have been treated as living documents, and they continue to evolve as new information, new research, new funding, new partnerships develop and come to be. And so the staff working in each of those priority areas were encouraged to regularly assess those work plans, revisit them, ask questions about what makes sense, what's feasible right now, where are some areas that we didn't foresee that maybe we need to move into. And so those were regularly updated and that will continue. And then there's a continued focus on health equity as an underlying principle of FIP. So I just want to give a huge thank you to all of the staff working on the FIP. And I have the leads and sponsors mentioned, but I want to mention there's staff in each of these work groups across all of our divisions, and there's many, many staff working on this. And I think that they deserve a huge thank you for all of their work and continuing to move this work forward, given just challenges and this is not easy work. Systems-based work is difficult and takes time, and I just want to make a public thank you to all of them for their work. Again, I'm not going to read these slides to you. These really outline, again, the goals and then those objectives underneath. And as you can see, there's a lot in this plan. There's a lot in this plan in every area. And I don't want to take too much time in reading you all of what was in the plan, but just kind of give you, wanted to have these documented in the presentation, but really kind of allow you all to pause and ask any questions about these priority areas, those goals and objectives, and any of the work that was accomplished. I will mention that I am not, my team oversees the process of the FIP and the planning and the oversight, but we are not involved in the day-to-day work of all these activities. So I can answer high-level questions, and if you have really specific questions around some of the work, we can either have one of the FIP sponsors or the other FIP staff respond. I just wanted to pause and ask any questions before we move into just areas of where we're continuing to plan.
Kelly, I'll just mention that it just seems like the team was very forward thinking in picking these priorities, because it would appear that these are indeed the major public health challenges that are emerging, particularly after COVID.
Yeah, absolutely. And I think that speaks highly of our planning process from the 2018 Tchd forward, and all of the different ways that we garnered community input in that process the last time around to help develop and prioritize these areas. And obviously, all of these areas have been incredibly important since COVID has hit, and will continue to be important in the future. Well, that was an awful lot of material to go through. Thank you.
I'm not seeing any questions. Did you want to?
Forward. Feel free to reach out to me if you have any follow-up questions as you might dive into the report a little bit more. We tried to kind of highlight in that key takeaway box in that report to really summarize, but there is a lot of content and it was difficult. I was trying to even just summarize it on slides and I just decided, you know, it's in the report. There's so much work and so much diverse work that happened. So I really encourage you all to dig into that report. And we will continue moving forward. So I just want to move over into talking about the community health assessment, which we've presented a couple of times to the board. Again, going back to the 8 phases of CHAPS, and we are working on multiple phases concurrently. So we're in the process of conducting the 2021 community health assessment. Those are required every 5 years. And as we mentioned before, Tri-County really wasn't due for another health assessment necessarily this year. But with the COVID pandemic, it being such a large disruption event, really globally, but locally especially, we decided we really just need to assess where our communities are at right now and hope that it will be a useful tool in planning our future work. So we are still in process of gathering all of the information from our focus groups. The survey ended in October, and we are in the process of analyzing all of that data and compiling it. We hope to share the results of the 2021 CHA in early 2022. And we're really working, my team is working on developing a process for step 5 of CHAPS, which is how will we move forward from this 2021 CHA to help prioritize issues? And that's obviously complicated by our organizational changes. So we're really looking at how we can increase engagement, even improving upon the process that we had in the 2018 CHA and moving into the 2019 FED, looking at how we engage county governments and our elected officials, our constituents. We really would like to report back to the people that participated in our focus groups and our surveys so that there's, you know, we're sort of closing that loop with them. They gave us information and we want to make sure we're reaching back out to our partners and the CBOs that we work with regularly and our health system partners. So we're thinking through all of that. And our next steps continue to evolve as sort of these organizational and governance changes here for Tri-County come to be. But we really are hoping that the CHA, so that's a benefit of doing the CHA this year, or sort of an unforeseen benefit, is that we hope that it will help inform the future of public health services in whatever form that may be. So please stay tuned for more information on the results of what we found. We have already shared that preliminary finding from the surveys out in written form. And then, yes, we're still working on the qualitative assessment and quantitative assessment as well. So strategic plan update. So our 2019-2024 strategic plan, we went through a very rigorous and insightful process with staff to develop those goals and objectives that were shown in the earlier slide. And a lot of work was accomplished. We reviewed that with you all at our July board meeting. And there was an inventory done on all of the work. But with the recent organizational changes, we have decided to pause that strategic plan and really focus more on priority activities around our organizational changes, defining that future state of public health services and our role in provision of those services. So, so we will be working through, what that will look like, and really what we're terming our transition plan. We may find a better term for that, but right now that's what we're calling it. That will really replace our 2019-2024 strategic plan, and hope to share more information with you all about that at a future meeting. I will pause for any further questions.
Kelly, could you just clarify, when you say the community health assessment analysis will be finished or wrapped up in early 2022, Are you talking about February? Are you talking about March? Do you have some sense of how much more time it's going to take?
Yeah, so we are hoping to be complete with our analysis, both the quantitative and the qualitative in December. I think what the final products look like, we would like to do some engagement with our county governments in particular, in terms of what would be most useful to them. And so we'd like to garner some feedback from them. In the past, we have done a single community health assessment report for all 3 counties. And I think we're hearing very clearly from county government leaders that they would really like some sort of report or focus on their single counties. And so that would just, we're talking kind of about increasing the scope of that project for my team from one product to multiple products. And so we're looking at, you know, how long that would take and if that's really an ask of us. So we plan on digging into that a bit more with our elected officials very soon. So,
any questions or comments? Well, thank you. Thank you for all your hard work, Kelly, and thank you for that update. We will now move to Tracy and Selma's presentation focused on community groups that have been involved with the COVID-19 vaccine effort. And Tracy, I will leave it to you to introduce the panelists.
Great, thank you. Just a sound check. Yay, okay, thank you. I'm honored to be joined by 3 organizations that have worked at the heart of the community to be responsive to and serve their neighborhoods and their neighbors throughout the COVID-19 pandemic. Tonight, we will hear directly about what's important to them and their communities, their successes and challenges, and the next steps in getting as many folks protected from COVID-19 through vaccination as possible. Please join me in welcoming Amanda Blaurock, co-founder and executive director of the Village Exchange Center. She's joined by Jose Gomez, natural helpers and vaccine program manager. The Village Exchange Center has become an anchor in their community for support and empowerment of immigrants and refugees in the Aurora, Denver metro area. We're also joined by Olga Gonzalez, Executive Director, Rocio Franco, Associate Director, and Guadalupe Villalobos, promotora from Cultivando. Cultivando serves the Latino community of Adams County, focuses on community leadership to advance health equity through advocacy, collaboration, and policy change. Finally, Daniel Stang, grants manager with Sisters of Color United for Education, which boasts the oldest promotora program. Their holistic health education model utilizes an original, culturally responsive curriculum to address intergenerational cycles of health disparities. Without further ado, I'll turn it over to Amanda and Jose to start us off.
Thank you, Tracy, and thank you all for having us on. It's an honor to be even part of this call, so thank you so much. Just to start, and I was trying to see if Jose was able to join the call, but I can't tell with the panel, so I'm just going to go ahead and start. But basically, last year we started with the Left Behind Workers Fund, where we gave 12.6 million out to undocumented immigrants who got COVID and were ineligible of receiving any unemployment insurance or CARES Act money. And we were the payment partner and a screening partner on that program. And that was the beginning of COVID. And then towards the end of the year, we partnered with Tri-County Health and started with Adams County to do something called a low wage worker fund. With that fund, we receive referrals from Tri-County. You guys provide a referral of somebody who has received COVID, and then we do a assessment and a screen with those individuals to see if they are low wage, low income, and if they wanted to receive a $1,500 grant from us that would allow them to make the decision to quarantine. I was adding all of that in because I wanted to kind of get to then starting kind of what we have been doing around the COVID efforts. So the next stage of this was becoming a governor's pop-up clinic for the vaccine equity clinics. And then we became a stand-up clinic. With that, we partnered with 9 Health, who is the group that actually is doing our clinics. And they go from once a week, twice a week to once every other week, depending on what's going on. And then towards kind of August, we started a pilot called the Vaccine Equity Fund. With that pilot, we decided to provide $250 stipends to individuals and up to $1,000 per household to BIPOC individuals that were Adams County residents. And with that, our vaccine clinic went from not many people to probably one of the most successful in the area. We hit about 200, I think in 30 at one point within 3 hours. So almost a person a minute being vaccinated. When we stopped doing the incentives, it went all the way back down to very small amounts. And if we have Jose, I wanted him to go ahead. Oh, there he is. Hi, Jose. I'm going to pass it to Jose to talk about why we think we have had the successes we've had. Go for it, Jose.
Yeah, sorry, the show's under Amanda, but my name's Jose. Here, I'm the Natural Helpers manager. Pretty much is our version of community resource navigators. One of the big things have been, a lot of people feeling that this place has been a safe place for them to come and get vaccinated. We are a block away from a Walmart and a Walgreens, but yet they still chose to come here because this is a place where they've come and gotten food, or their kids have been involved in a kids or youth program, and they feel more comfortable here. So that was one of the main reasons why we had so much success. Apart from that was because of the influence of what our natural helpers, which is, again, our community resource navigators. They're within the community. They've established relationships for long periods of time with the people in their community, and they've shared with them, that we are having vaccine clinics, and, and they know that once they get here, we've had people that, they came in and say, we're not here to get vaccinated. We just want information. And we sat with them for 15, 20 minutes and just kind of educated them with the information that we have. And some left and came back and got vaccinated, and some got vaccinated right after that conversation. We've had people calling us. We have a live person answering a phone pretty much any time of the day, early or night, with people that have a lot of questions. And that is not just a voicemail box or a 1-800 number, but it's an actual live person contacting them and reaching back out to them, answering all their questions, educating on them on the information that we have, and then frequently going to different places where a lot of our community members go and do business, mom and pop shops, local carnicerias, little meat stores, or ice cream shops nearby, different bakeries, people that we've associated with, and we're there on the ground handing out flyers and information. And I mean, it was a big success, especially with the incentive program that we had. A lot of people were afraid to miss a day of work because a lot of our people in our community either work late hours or even the weekends. They really don't have a day off. So them missing a day because of the symptoms that they may get from after getting vaccinated, they didn't want to risk it. But when they heard that we were giving this incentive, they came and they got vaccinated. So, we're still doing that. And that's what we've been doing so far.
So just to add to that, thanks, Jose. I think, in terms of some of our partnerships, like having the 9 Health, having the VA hospital doing referrals to us, also working with Tri-County Health with referrals and understanding kind of where the needs were. And as we were trying to create policies, I think Melissa's on this call, and obviously Tracy, but really having the support of Tri-County Health as we're considering, what are the criterias for these funds? Who are we looking at? Who are the most at-risk populations as we're asking for money from different counties? And I think the county partnerships and the city partnerships have been massive for us. I think in terms of really having the success that we're at now. And then in terms of our next steps, I mean, really looking at, we were approved with Arapahoe County to do the low wage worker fund with Arapahoe County, and then recently with Boulder County. And hopefully we're going to apply again for Adams County to do low wage worker fund because we just gave out 300 grants and we expended the money at this point. And then in terms of the vaccine equity fund, if we are to get more money for the vaccine equity fund, the idea is to move around the Tri-County area, depending on where the funds come from, and provide our incentives to other clinics. So we have set ourselves up This is why we did these funds in the first place, like we did with the low wage left behind worker fund last year, with a kind of a back office program called Aid Kit that allows us to scale. So we have cards that are actual cash incentives to provide to people, and actually move forward in other locations to make it really simple and easy. Anything else you want to add, Jose?
No, I'm just the importance of the, vaccine equity. A lot of people, even to this day, they're saying, I want to get vaccinated, but right now I just can't if there's really no money right now. So we've seen a big decrease in the numbers of when we've had the funding and when we don't. And, it's really helping a lot of people, especially when they're larger households.
Thank you, Amanda and Jose. I see that Rosanna has a question for you.
I don't see the question.
Kaya, is it all right if we hold questions till the end?
Works for me. Rosanna, just hold your question, and it may be that you'll have more as we hear more of the presentations. Thank you.
Thank you. I'm going to turn it over to our friends at Cultivando, and Olga, I know that you've got several folks joining you. I'll let you decide who goes first.
Yes, thank you all. Good evening. We appreciate the invitation to be here with all of you to share sort of our experiences and our learnings. And as you shared, and as we do culturally, we also would like to honor Belinda Garcia, the founder of Sisters of Color, for bringing and having the vision of promotoras in Colorado. Definitely, it's our superpower at Cultivando, is having folks who reflect the communities that we're in. I'll just give an overview, just touching on some of the activities we had, but then I'll turn it over to my team to talk about what worked on the ground and maybe possibly some recommendations for future work. So we've done everything from education around COVID, in the beginning, really referring people to testing, first of all, and then it's been around vaccinations and supporting our partners to ensure that the services were accessible to our community and relevant. We also have participated in producing informational videos in both Spanish and English to reach our community, talking about our stories of why we got vaccinated and that we're still here. It hasn't taken us out. And so really encouraging people to also take steps to protect their families. So again, we've supported a lot of efforts in our county and surrounding areas. And they'll talk about how oftentimes it was unfortunately last minute. So they'll probably mention this, but on one occasion, they actually enrolled over 600 people for vaccinations within a 24-hour period, which we could have probably done more had we had more time, but that's for the Q&A, I think. And in addition to that, supporting folks who were in quarantine and needed food to be delivered. And then, of course, ongoing is really just supporting our community because there are still after effects from COVID. People are having, secondary health conditions, lingering conditions, and we're also continuing to support the mental health of our community. Many of us continue to do our work, but it is still a very traumatic time and still much work to be done. So with that, I'll turn it over to Rocio Franco, our Associate Director. Thank you.
Thank you, Olga. Thank you for that introduction. Thank you for having us. My name is Rocio. I'm the Associate Director for Cultivando. And as you mentioned, and Belinda mentions as well, we work with promotoras who are trusted individuals in community. And their focus has been on assisting with COVID vaccination registration and helping the Latinx community members to dismiss the fear about the vaccine. These conversations happen in locations that are well assisted by the Latinx community, like churches, local stores, neighborhoods, and even events like the equity clinics that Tri-County and the cities in the county are running. Our focus is to develop strong cultural responsive messaging to reach families through one-on-one conversations, small group settings, social media. The outreach is focused on reassuring messaging about getting vaccinated to protect our families. And one of the messages, as you mentioned, Olga, is setting ourselves as an examples on why we got vaccinated and why it's good for community. I think setting the example and just having that relationship with, the access of vaccine put us in a different stage with community members. And besides these efforts, also we have done a lot of following with community members prior, during, and after the vaccine process. When I talk about this is, there's a lot of questions, when you're registering or when you get to these places that sometimes, bilingual stuff is not provided, or bilingual signage is not provided, or they're not necessarily following on, where to go to get the second doses or the booster, things like that. So I think the promotoras have done an amazing job providing those details to community members and sharing what's the next step, what to do, where to go, and things like that. So before our time is up, I would like to share my time with Guadalupe. It's one of our promotoras, and she also has a lot of, that direct access working with community members. Guadalupe.
Muchas gracias por invitarnos y compartir con nosotros. Me llamo Guadalupe Villalobos. Yo vivo en la comunidad de trailas de Pine Lake Ranch, donde hubo el evento de vacunación recientemente. Y me di cuenta que nos habían enviado un volante para informarnos de la vacunación en inglés. Fui a hablar con la manager y le pregunté por qué esta información que es tan importante para nuestra comunidad no está en español. Y ella me dijo que el evento no era de ella, que era del condado. Entonces nos pusimos en contacto para pues hacer alcance nosotros uno a uno. Y nos enteramos de que sí tenían que haber enviado algo en español o bilingüe. Entonces las promotoras, mis compañeras y yo empezamos a caminar por las calles de las trailas y a buscar a las personas y a hablar con ellos para ver si sabían del evento, y no sabían, no habían visto ese volante. Así que me di cuenta de que hay muchas inequidades todavía para nuestra comunidad cuando se crean estos eventos y no son inclusivos o se pierde la comunicación. Somos muchísimos residentes hispanos en esta comunidad y y no estaban enterados, pero sí vi que querían vacunarse. Pudimos platicar con ellos y saber si tenían dudas, resolver las dudas que tenían. Y también darle seguimiento después, porque muchos te preguntan después de la vacuna, como dijo Rocío, ¿a dónde voy a ponerme la segunda? Porque muchas veces no les dan esto. También pudimos hablar con los bomberos y con las chicas que estaban poniendo la vacuna del flu y ver la importancia de que ellos estén comunicándose entre ellos para que sepan cómo tratar a la comunidad, más que nada que tiene barreras, en este caso del idioma o dudas, porque a veces puede que ya estén allí, pero si no hay quien hable español, se van a ir. Eran muy amables las personas que estaban aplicando la vacuna, pero pues tenían esa barrera de la comunicación del idioma y nosotros pudimos estar ahí un buen tiempo para animarlos. También nosotros en los mensajes que estuvimos dándoles a ellos cuando caminamos por la comunidad y entregamos los volantes, era de que iba a haber personal bilingüe, que les iban a dar una tarjeta de $100 por la primera o la segunda dosis, que iban a tener pues algunos refrigerios. Muchas cosas de esas no estaban funcionando. Yo noté mucha desconexión entre las personas que estaban aplicando tanto lo del flu como el COVID. Estaban separados. Entonces, creo que fue un tiempo de aprendizaje para todos, pero pues hemos hecho, como ya dijeron mis compañeras, bastante trabajo porque queremos que la mayoría de la comunidad tome esta vacuna. Y hay muchas personas que ya están tomando la tercera dosis, el booster, y entonces también eso recibimos muchas llamadas para preguntar en dónde. El haberlo hecho en domingo también fue algo muy bueno para personas que trabajan. Entonces también estuvimos en Red Hood Ajá, otra comunidad de trailas. Y también había muchas familias que no sabían del evento de vacunación que iba a suceder en su comunidad. Entonces, siento que hay mucha desconexión todavía en esto y que todavía faltan bastantes personas de vacunarse. Así que gracias por la oportunidad.
Thank you, Guadalupe. I hope everyone recognized that they have English speakers. You could have Guadalupe's comments translated in English by using the interpretation button. Thank you very much. We really appreciate you coming. Tracy, I believe you have, is Daniel going to be speaking to us as well?
Yes, absolutely, Daniel. I'll turn it over to you. Thank you so much.
Muy agradecido a todos. Me gusta decir, especialmente para Tracy, invitarnos. Aquí me siento un poco humilde para representar una agencia como Hermanas de Color y como no siendo mujer, pero a veces aprendí mucho a respetar a los de las mujeres por mi cultura. Quiero agradecer a todos los de la salud pública porque son los verdaderos, me emocionan ellos porque son los verdaderos miembros de la sociedad que entienden las iniquidades y son las personas que quieren luchar por la bienestar para los demás de todos. Yo voy a cambiar un poquito en inglés because I do a little both Spanglish and a lot of times when I'm out in the street. And I want to apologize for my director not being able to be here. But we have been very involved and very excited to be receiving the funding that was graciously done and the access to medicines that the community needed. We got one of the first Sheridan City 600 vaccines in like one of the first weekends in March. In fact, Commissioner Carrie Warren Gully contacted me about that. Wow, you guys got that first. And I said, well, the promotoras, they're on the ground. They know how to get out to people's and to find people that are usually isolated or don't know where to get contact with resources. We had a really great success. We're continuing. We have a mobile van coming next week at the City Hall. Our promotoras have a incredible amount of stories of families that were, because of travel and stuff, they weren't able to make connections, and the promotoras being able to get them to vaccines, also to get them the proof of their vaccine. There was a gentleman I remember personally that was trying to get to Guatemala, and to get his proof, was a barrier for him. So it's great to know and to feel the benefit of our work in there, and we really appreciate all the support that you guys have given us. We are, and I want to say personally from myself, I was sort of an anti-vaxxer for most when I was a young man, and my 5 children never been vaccinated from the other vaccines. I used to get into some arguments with some of the people on public health events and in the past, but I got the vaccine right away when I heard about COVID. And I know there's a lot of people that are still curious and cautious, and I feel like a lot of some of the surveys that we do in the community, some of the discussions that we have with people, they're just not confident yet. And there's a lot of occasions where you have to just kind of respect their wishes. And so we understand that that's going to be a challenge, but also in a way, it is an opportunity for all of us to start opening those discussions about. I know there's a lot of, I'm also on the school board, so with mask mandates and those sort of things, there's a fine line between that health and then absurdity of like too much protections. I don't know. We used to be the queens of condom in Sisters of Color, so we used to give out condoms in these roses, but how many condoms can you wear to really be safe? We used to joke about. And so, I always like to bring in a little bit of if some people consider it a controversy, I just say it's challenging some of the actions of what we're doing. We know that there's a lot of people that maintain a sense of their health in their spiritual, emotional, and cultural manners. And so, there's no reason to have any negative impact on them for the choices that they make. but we are definitely, the majority of our promotoras, well, all of our promotoras have been vaccinated in Sheridan, where I'm working. We started about 2014 doing our training here. We have about 40 strong promotoras that are, 4 of them are our leaders that are conducting a lot of the vaccine clinics. They've had some challenges with Sheridan Health Services, for example. They're a really close clinic with us, but they're School of Nursing. And so the barriers of language, cultural things, sometimes they'd come in, they were there to help translate and do a lot of that, but they didn't really feel very welcome to be a strong permanent part of the clinic at all. So those are always little bits of challenges that we've been dealing with. And, we just got to keep putting that one foot forward, keeping our communities in a positive light. We are definitely setting up for boosters already. We're planning with the city for our first booster shots at the beginning of December. So we know that the work is there. It's good work to get everybody informed. I really we send a lot of people to Jose out in Aurora too, because of we never brought on the incentive piece, but sometimes that helps, but really what I was grateful to was when we got the education about, the real science, because that helped us with a lot of people to understand that, the vaccines to not get caught up in sort of conspiracy ideas that are just some of them are really far off. So we definitely had also benefited from this motivational interviewing that our promotoras were able to take with public health. So we've really been grateful, and we feel that it was really it was a benefit. It was kind of a flashback with us in a weird way. Some of our staff, the old staff that were like, we remember the HIV epidemic and the way this new virus, and how everybody was in fear. And I think we've seen that there is a little polarity to, perhaps in our country as well, that's on a different level. But I think around health issues, we've did a lot better as seeing people willing to come and learn more about it, get vaccinated, and not treat each other in isolations. And very much applaud you guys for all the work with the equity, bringing in the language barriers, passing those, and look forward to continuing. And thank you again. Thank you always for the support. We really appreciate you guys. And it's great to see some good friends like Olga. Gracias thanks for Belinda. I'll be glad to hear you say that. And buen hecho, Guadalupe. Thank you.
Thank you, Tracy. Did you have any concluding comments?
I think we're all very aware of the fact that 5 to 11-year-old vaccines are now available. We are in allocation in the state, so we're continuing to work with our community partners, some represented here tonight, and many, many others, to ensure that those kids are getting vaccine when they're ready, and also really recognize the need to continue to vaccinate our 65 plus who are yet unvaccinated, as they continue to have the greatest number of hospitalizations and deaths. And I just want to throw out there to anybody on the panel, plans for 65 plus, are you thinking about that? And then I want to make sure that the board has a chance to ask questions, and we can get follow-up from the panelists if we don't get a chance to answer all of them.
I can start out and then my team could chime in. Because our community is very intergenerational, and oftentimes people who are elders live in our homes. And so I think when we have opportunities to accompany them and we get vaccinated at the same time, it's much more successful. Oftentimes it could be intimidating for them to fill out forms. And some older folks have mobility issues. And I know, like for my father, who's in that age group, it's like me going with him and interpreting and helping him fill out forms made it a lot easier, because as Danny said, any of us really jumped to get vaccinated. For myself, I was one of those rare cases where I actually had COVID twice. And so I said, okay, it's time to get vaccinated. And and then initially when the guidelines were very strict on the definitions of who was getting vaccinated, I feel like I get the intent, but it was also a missed opportunity to vaccinate more people in our community. We could have had these, intergenerational vaccination drives and really embracing the family idea, like families get vaccinated together. I think we could have navigated some of those barriers as interpreters, and just to answer questions for our elders as well, and just get them more comfortable with the process. So those are some of the thoughts that that we had, and some of the things that in hindsight I think could have been super helpful. And I think we continue to just message about how we value our elders, our grandparents, grandmothers. We want them to be around for a long time, and we love them, and we want them to be protected.
Any other panelists want to add to the 65 plus intergenerational types of outreach?
Yeah, this is Amanda. I think what we're looking at right now with having a food pantry that has 6,000 people we serve weekly, and how do we like do exactly what she just said around the intergenerational outreach. So we're always looking at how we can overlap our programs. And one of the most recent ones that we just put out, and I don't know if Jose is still on because I'm now having to drive, I'm sorry about that, but right now we have a clinic, and so what we've decided to do is to look at how we can provide Thanksgiving incentives and vouchers to people who get vaccinated. So overlapping our programs so that we can actually just get more people in, and we do serve a very large amount of people over 65 as well.
Yeah, because a lot of people here at our center, the parents have come and got vaccinated, or the grandparents at earlier stages of the year, and now it's just their children. But it's to motivate them. So we are coming up with creative ideas, and hopefully for the 18th, our next clinic on Thursday, we're going to be able to have vaccines for ages 5 to 11, and at the same time still hand out these Thanksgiving vouchers for people to really get them into the idea of spending the holidays safely together, as we do, whether it be for upcoming Christmas or New Year's, but everybody in the households, including the kids, are vaccinated.
I would add, we do a lot of that precision targeted stuff. That's what's, that key that promotoras and community workers have been successful at, and finding unique ideas, and providing even just the education about, if somebody who has a lot of fear for vaccination, that they understand transmission, they understand that, and my sister-in-law too, Olga, when she didn't want to get vaccinated until she got the virus, so that happens too. But, giving them that education to understand how we are as human beings, we're just walking bacteria bags. And so, let's make sure that everybody understands distancing, respect, and space. And so I think that was a good motivator.
Thank you, Rosanna. Thank you for your patience. I know you have had questions. Please.
Hit my unmute. I was excited to see Sisters of Color United for Education here, because in my previous life, cuando yo soy la directora en Clínica Tepeyac, trabajo muchos años con Belinda y todos allá, con los promotoras. Tepeyac also has had a rich history of promotoras. So my question for Jose, I don't know where you went, Jose. Where is he? Is he still on the
Right.
phone?
Yes,
Okay. ¿Cómo son sus trabajos, su relationship con las enfermeras en la Feria de Salud, Channel 9?
Muy buenas. They've been very, very amazing. Very patient with a lot of our community members. A lot of them, they come in and they're wanting to sit and conversate the idea of having vaccinations for about 15, 20 minutes. Obviously, we have our team of our natural helpers trained with as much information as we can, but if we still feel that there's still some reluctance, we bring over one of the team members from 9 Health, and they've been amazing to stand by us and kind of answer maybe a little bit more extra questions that people have, and people feeling that, their questions is being heard, and it's being explained, not just in Spanish, but in a Spanish that they can understand, or in a language that they understand. Is not just a Google Translate of it, so it's just one of those things where we make it relatable, and we've seen success for it. Yeah.
Entiendo completamente. I just want to emphasize, thank you all for being here. Guadalupe, especially. I only see a little bit of Guadalupe. Okay, there you are. Thank you. Gracias para su tiempo esta noche. Muchísimas gracias. I just want to talk, I really appreciate you all coming because I know you work long hours and are very dedicated to the community. But this is something that, has been, this practice is not a secret. We've been doing promotores in Colorado for 35, almost 50 years around the state. So I really appreciate you bringing that during this hard time, during the pandemic. But I also want to say, I know I have referred some families. It's not just areas, Latinos who are from fiscally challenged families. I referred some families to Tri-County for vacunas para la bisabuela, abuela, for their boosters, and the others to get them others, brother-in-law, sister-in-laws, and these were not people of modest means. But they're Latinos, so they all went together. So it's across. I just want to emphasize for the board that's across the community.
I think you hit the spot. You hit that understanding of relationships. That's the really key thing about all of this continent. There's a whole spectrum of and people see different tribes or different nations. It's really one culture, man. From all the way Panama all the way to Alaska, it's one original culture that is this land that was all about building relationships. And
I have one more question for the panelists. Have you had any trouble with people from your vaccine clinics being billed by the medical provider?
No.
Okay.
No, not
because
from
that is
us.
something I heard, and I will put that in the chat to John about some folks going to some of the equity clinics getting billed for an administrative fee. So great, that's good news.
They're worried they're gonna have to pay, and that's why they
Sí.
Pero no, sí. Todos bien.
Bueno, good.
Gracias. And excuse me I have to jump off. I have to go to my school board meeting in 10 minutes. So, gracias todos. Hasta luego.
Igualmente.
Chao.
Gracias usted. Ya es todo, Kaya.
Thank you. That was just terrific. I would ask if anybody has any other questions to follow up with Tracy. I'm sure she can give you additional information on these wonderful programs. We're going to have another health equity update from Grace now. Grace, the manager of the health equity initiatives at Tri-County.
Thank you. All right, hello everyone, good evening. I'm Grace Solon and I'm going to share a brief update about health equity initiatives, ongoing and future. So first and foremost, I engage with all of our COVID programs at TCHD as both a thought partner and a strategist. And my main goal is to identify opportunities to align our health equity efforts across the response. A few of the outcomes of this work include our community messenger project with some of the partners that we just heard from, continuing education for our investigations task force, and identifying training needs across the response as well. I also facilitate our internal health equity action team, which is made up of TCHD staff who are passionate and dedicated to continuing health equity work. We've had 10 meetings since August, and we have about 10 to 15 staff members join each meeting. And our purpose is to create an inclusive learning community for staff to inform and engage with this work across the agency. I'm also involved in our strategic plan and FIP work groups. And I've been working with a collaborative group of TCHD staff and CDPHE to create a health and racial equity framework, which will illustrate our future vision, our current state, and help to identify action items required to bridge that gap. I am a member of the MDPH Health Equity Work Group to align our efforts regionally. And on an ongoing basis, I conduct key informant interviews within each division to help map, connect, and activate this work. One project I wanted to share in a little bit more detail this evening is a qualitative data analysis of staff feedback at TCHD, specifically regarding health and racial equity. And I partnered with Tanisha Dubose from HR for this project. We compiled relevant qualitative data from staff feedback sources, which are listed at the bottom of this slide. And they were all relevant to health and racial equity. And we analyzed the data and pulled macro and micro themes, such as accountability, action, emotion, power, privilege, etc., to get a sense of where our staff are with this work and how they would like to engage. And we plan on incorporating this feedback into our current and future equity efforts. Just a sneak peek at some future efforts. We are working on completing trainings both within the specific COVID staff and general TCHD staff. And we have a 100% completion rate for the health equity and environmental justice training among our COVID programs, and a 90% completion among general staff for the intro to health equity and racial justice training, hoping to get 100% of staff trained by the end of this year. And in the future, I hope to conduct a diversity, equity, and inclusion assessment, which will map our current equity efforts and inform an agency-wide action plan to further those efforts. In January, I plan to include a health equity component to our pandemic response after action report. And finally, I've been collaborating with HR to explore what options we have to further champion our equitable hiring practices. So I just wanted to share a quick update with you all. You heard from me, I believe, in August, a few weeks after I'd been hired. So I wanted to report out a little bit on what I've been working on. And thank you so much for having me.
Thank you, Grace. I was just curious. I know you focused on the internal work around health equity and mentioned the health equity framework. Is that also work connecting to the community health assessment that Kelly described earlier?
Mm-hmm. So I've been asked to be a reader and a reviewer for the sections of the community health assessment that they're compiling currently. And I'm hoping to use the data from that assessment to inform this work more externally in the community as well.
Great, thank you. Did anybody else have any other questions? Okay, seeing none, let's move on to our next topic, which is the COVID-19 update. Dr. Douglas.
Thank you, Kaya. Well, this is, Lisa, if you could put this into show mode, whatever that's called. I really want to thank Tracy for pulling that panel together. And of course, much more importantly, the panelists, they were fantastic. I particularly want to thank our board members who suggested it. We've been working a lot with these folks, but it's so fantastic to hear directly from them. So thanks to the panelists, thanks for the work you're doing. Thanks to our board members for the great idea. And really think it's a model of the kind of work and the kind of partners we want to be doing, not just in COVID, but far more broadly. I was chatting with Brian Lavicek about Cultivando's work in air quality monitoring, for example. I just think there are many, many ways we can be interacting together. So I want to thank that group a lot. I want to thank Grace for giving us a summary of the work she's been doing. I think those presentations pair together very nicely. So let me leap in and try to move along. I've seen several board members on our calls this week, and I don't want to repeat things you may have heard, although there are more than board members here, so I'll sort of go through the situation. Next slide, please, Lisa. I want to go over sort of the trend we're seeing in COVID, a lot of which you heard me talk about, but I'll show you some of the data. Critically, really, I think in follow up to what we heard from the panel is where do we stand with vaccination? What are our priorities? I want to share a little bit with some of the recent modeling work from the School of Public Health. I want to talk about mask mandate considerations. This has been a topic of interest to the board and the community, and conclude with some looking forward reflections. Next slide, please. I just saw a quote from John Samet, the Dean of the School of Public Health. While we were meeting this afternoon, apparently the state health department either had just announced or announced while we were meeting that we're going to be using crisis standards of care in our hospitals. That is one step short of actually rationing care and making decisions about one person gets a ventilator and one person does not. But as the dean put it, we are in a shockingly bad state. And now these are data from 4 or 5 days ago, showing that Colorado very close to the top in the orange. At this point, we were I think the 4th or the 5th ranked state in the country. We're still the 5th ranked state in the country, but all the other states in the top 5 are going down and we're going up. So we are in a completely unexpectedly bad place in terms of where we stand with both cases, which is what these are, as well as more severe outcomes. Next slide, please, Lisa. These two really tiny graphs show you two things. It shows you back to the dawn of the pandemic on the left side, what's happening. I'm still showing you all 3 of our counties together because our dashboard is still showing Douglas County. And what I want you to focus on is how weird this place looks that we're at right now. We had that peak way back in the early pandemic, which looks like a little foothill. And then we had another foothill in July of 2020. And then we had Mount Everest last November, December. And then we had sort of like maybe, I don't know, Long's Peak or something back in April and May. And then what we've got now is very strange. It's not gone up and come back down. It's almost like a butte or a plateau. And the plateau in the last month or so appears to be going up even further. So behaving very strangely. And I can only conclude that this is some combination of a largely, at least partially immune population that's encountering still wave after wave of Delta. The slide on the right shows you trends by age group. You can't possibly make out the various age groups with all those different colors in that spaghetti. What I really want to show you is that little orange thing at the top. That's our 6 to 11-year-olds. It's not orange for Halloween. It's just how we've been coding it. But our 6 to 11-year-olds are now with higher case rates, not only with all 3 counties, which is what you see here, but individual counties, than we have seen since the pandemic began. They are also the highest age group. So it's no accident, I think, that what's going on is the unvaccinated are sustaining the brunt of the cases, or at least the plurality of the cases. Next slide, please. These data are broken out by Adams and Arapahoe, left and right, respectively. And now I'm looking just at the kids to unravel a lot of the yarn of those different colors. And again, the 6 to 11-year-olds, both in Adams on the left, Arapahoe on the right, clearly the top group. Next in Adams is the group in red, the 12 to 17-year-olds. Interestingly, that group is somewhat lower in Arapahoe County. And then we've got the 18-plus-year-old group in the turquoise just below it. So just remembering again, that's where at least a lot of the action in terms of cases appears to be. Next slide, please. And this is showing you that we're not unique. These are Colorado data from last week. Ironically, I think coincidentally, we've got the same color coding here, but the 6 to 11 statewide are clearly where the action's at for our population in general, and certainly for our school age kids. Next slide, please. This is not looking at trends. This is looking at geography. I've shown you guys this map before. These are tri-county census tracts across the 3 counties. Adam Anderson has modified this. So we're now looking at 1-week rates, not 2-week rates, because everything else I've been talking about is 1-week rates. And what I want you to see is the color coding, by the way, is the CDC's level of transmission. Level of red is greater than 100. And everything except Western Douglas County and the Rocky Mountain Arsenal, where virtually nobody lives, is red. It's above 100. And I think you can see that even in, for example, our rural areas, those are the 2 census tracts in Eastern Adams and Arapahoe County, the rates are actually higher than they are in most other parts of the county. That's 373 in Eastern Adams, that's 346 in Eastern Arapahoe. And I point that out because I think there's a sense that because we don't have that many cases out there and we don't have that many sick people, it must not be so bad. But when you adjust it for the rates of the population, it's actually as bad as most other parts of our counties. Next slide, please. On the theme of kids, let me show you what's happening in our school-based outbreaks and our childcare-based outbreaks. Left graph is schools, right graph is childcare. To orient you to the colors, blue are suspect outbreaks, meaning they probably have enough cases to be an outbreak. Outbreaks require 5 cases, but we haven't proven it. Orange is those we have proved it. And as our testing numbers have increased, we're seeing more and more of the outbreaks being confirmed. Now, that dip we saw at the end of August to early September is, I can't prove that that's related to the introduction of the mask mandates. And you'll recall that mask mandate for schools went into effect across the counties on September 1st. It's suggestive, but I think these data are far too messy to conclude that definitively. I will say that the increase we're seeing in the last 2 weeks anyway, and we have another increase this week, I don't have that data finalized enough to show, is almost certainly not because whatever benefit we're getting from masks, which I think is actually likely to be fairly substantial based on data that's been published by CDC and has been generated by the state health department. I don't think it's because that effect is lapsing. I think it's because those kids are seeing higher rates. And when you take a pretty good but imperfect strategy like masks, just like when you take a very good but imperfect strategy like vaccines and your case rates go through, you'll see more breakthroughs. And I think that's what we're seeing now in schools on the left. And as you'll see on the right, in childcare centers, we're beginning to see increases as well. Next slide, please. And this is looking at our school-based outbreaks cumulatively by level of education and by county. I'm showing you this just to give you that update. Arapahoe County, as you can see, has got higher numbers of outbreaks than the other two. Douglas has somewhat more than Adams County does. Next slide, please. So let's turn to severity, because that's just cases. And we're not on crisis standards of care in hospitals because we're seeing lots of cases. We're on crisis standards of care in hospitals because there are lots of folks getting sick. These are Colorado data, left side, new hospital admissions by admission date, same sort of funny geographic pattern. You had a huge wave back in April, much bigger than the case wave, and that's because we weren't diagnosing most cases, even though we had a ton of people getting sick. Little wavelet in July, big tsunami in December or November, December, January, intermediate peak in April. We got better in July. We were home free until Delta came. And now we see this plateau that's going up again, very, very analogous to what we see with case rates. On the right bottom are patients currently hospitalized for COVID. And the new admissions to the hospital tells us about acuity in the last few days. The people that are currently hospitalized tells us about what's stressing hospitals overall, because if somebody's in there for a week, that gets magnified more strongly than if they're in there only for a couple of days. We're now at a higher level for patients hospitalized for COVID than we've been since December 21st. So we are very close to some of the worst part of the pandemic from last winter. The top image shows you, this is a visualization taken from the CDPHE website. And they're now charting the relative proportion with these sort of icons of those hospitalized patients who are vaccinated, those who aren't. And that number, circled in green at the top, 80% of those currently hospitalized or unvaccinated, is actually hovering a little bit. I think it was 78% per day. But that's actually, I don't know if any of our panel members are still here. I see Rocio, is the reason that I asked Tracy to ask you guys that question about how do we get our remaining older residents vaccinated? Because it's that group that's not yet vaccinated that's really sustaining the majority of the really severe outcomes, the hospitalizations and even the deaths. Although I don't want to minimize the vaccinated part of the equation. And that's why the pushing of boosters, the state just announced officially today, we're not only saying, oh, it's okay for anybody 18 and above to get a booster. The state said today with the introduction of crisis standards of care, we're calling on everybody 18 and above to get a booster who's been at least 6 months since an RNA vaccine or 2 months since a J&J vaccine. Next slide, please. This is looking at hospitalization by age. I've shown you guys these graphs, I think each of the last 3 or 4 months. Left is everybody, those over 18 on the top. That is far and away the lion's share of hospitalization. Those in the younger age groups, 10 to 11, or 0 to 11, or 12 to 17 are in the bottom. Those are blown up on the right graph. Again, I've shown you this before. And the major thing I want to point out is that this is a very infrequent outcome in younger folks. But when you have more younger folks getting infected, then you begin to see more younger folks with severe outcomes. So you can see that our 11 to 20-year-olds, we have, as of last week when Dr. Hurley, he shared this data, there were 20 of them, and that compares to around 2 or 3 back in August. And our 12 to 17-year-olds who are more likely to be vaccinated has fluctuated a little more, it's a little flatter. So absolutely not huge, but certainly for the younger, hardly vaccinated at all kids, we are seeing increases. Next slide, please. These are admission trends, hospital admission trends in the Tri-County area. Take a look at the left graph. This is a histogram looking at hospitalization rates, 7-day new admissions per 100,000. And what I want to point out to you here is that toward the bottom is where all the metro area counties are. Boulder, Broomfield, Denver, Jefferson, Douglas, Arapahoe, Adams are in the bottom part of the hospital rate quotient. And although, as you see on the right, our overall rates in the top graph, the upper top right graph, are at that high plateau level, we are faring relatively much better than more rural parts of the state, particularly those that are less well vaccinated. The lower right graph emphasizes again what I just said about our older unvaccinated folks. The turquoise are the 75 plus. That's about 80% of our hospitalizations. And our red group, 65 to 74, is about another 10%. So that's the group that, even though that glass is pretty full in terms of getting them vaccinated, I think it's increasingly important that we look at the part of the glass, both in terms of primary vaccination as well as boosters, that's not yet been completed. Next slide, please. So now we come to the capacity part of the story, and I did have a chance to update these data as of today. So the map in the upper left shows you by Colorado hospital region where we stand in terms of ICU bed capacity. We're in the Mile High region. We're currently at 5%. Now, we've been that low before, but if you then look down to the table at the bottom, breaking out by our 3 counties, let's just look at ICU, for example. Adams has got 5% of its ICU beds free. Douglas at the bottom has got 5.5%. Arapahoe's got less than 1% of its beds free. We haven't been that low really ever. I mean, even last winter when things were bad, we had more beds and we haven't seen capacity shrunk this low. Again, we've now got more folks hospitalized than any time in late December. It's almost 1,500 now. And the North Central Region hospital survey data just reported that 37% of hospitals are reporting a projected staffing shortage next week. So this is probably as good a point of time as any to quickly go through why in the world are things this bad. They're this bad, number one, because of rising COVID. They're this bad, number two, because people are still getting everything else they used to get, appendicitis, heart attacks, car wrecks. They're bad, number three, because many conditions had delayed care over the last 12 months or so that have resulted in people getting sick enough to go to the hospital. These are cancers that were not adequately detected, or in some cases detected but not treated. Likewise for heart disease, likewise for kidney disease. But finally, most importantly, is that last statistic. It's the staffing shortage issue. And this is really emerging as the biggest part of our crisis at this point. This is the issue of when you stress a healthcare system and you stress hospital workers, particularly nurses and respiratory therapists, and they don't get a break. And when they get a break, another wave comes. This is what we begin to see. We are simply having trouble filling, or rather staffing, all the beds that we actually have. Next slide, please. So let's turn to what has been really now almost a year, 11 months. This is our big exit strategy, right? Vaccines. And vaccines are still going to be our big exit strategy, but it's taken longer than we would have hoped. So across the top, you can see our vaccine rates by our 3 counties, color-coded. You can see that we have stayed in a gradually declining place over the last 2 months, in spite of the fact that the news is grim. Our overall vaccination rates, let's focus on completed rates. They're getting better and better. Adams has gone above 70, almost 72%, Arapahoe 74, Douglas 78. And our boosters are actually beginning to move pretty fast. I'm really happy to see that. Adams just under 6, Arapahoe just under 9, and Douglas just over 9. But in that little sort of turquoise box on the right, our completion or increase rather in vaccination rates, completed vaccination rates since the last Board of Health meeting on October 13th is only 1.1% for Adams, 1.6 for Arapahoe, and 1.1 for Douglas. In other words, not a lot of progress in the completed vaccine rate for those primary doses. Next slide, please. Just showing you where we stand pretty much, I'd say, in the better part of the state. We're not near the top where you've got counties with 80+% vaccination, but we're certainly kind of in the middle rung. And you can see that the metro area in general, as I've already showed you by those hospitalization rates, is doing better than it otherwise would have. Next slide, please. I've also shown you these data before, but I want to give you an update looking at the correlation between case rates and vaccination, or hospitalizations and vaccination in the upper right, or deaths and vaccination in the lower right. And the downward tilt of the curve to the lower right is fewer cases or hospitalizations or deaths with your higher vaccination rates. So you're still seeing cases in the more highly vaccinated areas. But if you look at where you are with cases compared to hospitalizations or deaths, you can see this big differential, that while you may get infected post-vaccination, your chances of a severe outcome are dramatically reduced. And the incremental story that this graph tells makes it more and more clear that vaccination, while not perfect, has been extraordinarily effective in preventing much, much, much worse outcomes. Next slide, please. We mentioned earlier that we've got, improving vaccination rates, but less than we would like. I've already talked about our older folks and the fact that I'm really particularly concerned about them because those are the folks getting sick and dying. But I'm also concerned about our school age kids. And we're getting better, but we're getting better at about, a high 50s or mid 60s kind of level. And over the last month, since our last Board of Health meeting, our 12 to 15-year-old rate in Adams, for example, has only gone up 1.6%, Arapahoe 2%, Douglas 1.5%, and our 70-plus-year-old group has gone up even less. I think we've obviously reached the majority of the people that are going to be easy to reach. It was so revealing to hear our panelists talk about the issues that folks that are still not vaccinated may be facing, and you can see that the increases in those older groups are even less than our younger kids. Next slide, please. These are trend data by age group in terms of percent vaccinated. This is Adams. So focus again on the top. Gray is the 70 plus, brown is the 60 to 69. We're actually probably making our best progress in our 12 to 15-year-old group. That red line seems to have a steeper slope than most of the others. But really, since mid-July or so, we've been just frustratingly plateaued out in our older age groups. The next slide, please, Lisa, shows you the same data for Arapahoe County, pretty much the same story, although there's one odd twist here. Our 60 to 69 group, plenty of risk here, by the way, is actually lower and has been lower really since the end of May than our 40 to 49-year-old group. I don't know what's going on in terms of that age group in Arapahoe County, that it should be, I think really two things are happening. We're doing better in the 40 to 49-year-olds. You can even see that slope looks slightly steeper. And for reasons that we haven't completely sorted out, we're frustratingly flat in the 60 to 69-year-old group. Next slide, please. These are trend data, which are now looking not at age, but race, ethnicity. We've been looking at these at every meeting for the last 6 months or so. Main thing I want to focus on here is that we are still seeing glacially slow improvement in our white to Hispanic rate ratio. That's now down to only 1.6, but it's still behind. We still see a gap. And I think we heard a lot tonight from our panel about things that we have been doing and ideally should be doing even more to try to address that gap. This is Adams. Next slide, please. Pretty much the same story with the Arapahoe, very similar white to Hispanic rate ratio 1.5. Next slide, please. And Tracy has talked to the board off and on over the last several months about what we're doing in the neighborhoods that were particularly lagging, where we were trying to put extra boots on the ground and extra partnerships and extra vaccine sites. Those priority neighborhoods are the Aurora part of Adams, the Aurora part of Arapahoe, Commerce City, and then more recently we added Federal Heights, Sheridan, Inglewood, and Thornton and North Glen. And, you know, I would have to say in all fairness, we are seeing progress, but we're not catching up with the counties at large, which is what the orange for Arapahoe and the blue is above. So I think the work is, we certainly are encountering incredibly fantastic partners to work with, but it's hard work. I mean, it's really hard work to get folks that have access challenges to take advantage of these critical vaccine products. Next slide, please. I want to say that the district-wide efforts are including, or rather continuing to focus on equity, both by the community organizations, not just the ones you've heard from, but they're obviously fantastic, as well as ourselves, both in terms of COVID prevention, appropriate, culturally appropriate education and navigation, and then trying to identify when we have opportunities for new vaccine sites. We're continuing to work in those priority neighborhoods, and our priority populations include the younger group. And I'm so happy that the panel reinforced this notion that families are the name of the game, and trying to figure out whatever we can do to make the family the unit of vaccination, I think will help us. We're clearly worried about those folks in long-term care facilities and are homebound, as well as other older folks. And then because persons experiencing homelessness are often not well taken care of by other parts of the healthcare and public health sector, that remains a priority for us as well. Next slide, please, Lisa. Breakthrough infections. Focus on the darker part of the histograms along the bottom of the axis. And what you see there for Adams, Arapahoe, and Douglas in the yellow, red, and orange is the percent of all cases that are due to breakthroughs. And you can see that the darker part of the histogram is getting higher. It's a bigger part of the equation. And so, for example, in the month of October, 39%, 32%, and almost 40% in, 32, 39, and 43% are due to vaccine breakthroughs. Not at all unexpected. We're not really, I think, yet seeing the benefit of the boosters, and the boosters haven't really taken off. These are cases. Next, excuse me, next slide, please. These are hospitalizations. Again, I've already shown you what the state number looks like. It's not so different here if you look at the month of October. The proportion of hospitalizations in Adams that are vaccinated, 21%, Arapahoe, 31%, Douglas, 36%. Those numbers are screaming for boosters. Now, some of those people probably have been boosted because they probably are immunocompromised and may not respond perfectly. And even in an ideal world, 96%, which is huge, is not perfect. But that's the thing that is telling me pushing boosters is really a part of the thing we need to be doing. Next slide, please. Okay, boosters. So they've been recommended. And these are CDC's guidelines and sneak preview on the left side. And sneak preview, I've already told you that Colorado has fast forwarded. And Colorado has looked at the advice that says that if you're in a high risk setting, such as a high risk workplace, then you should, if you're 18 and it's been 6 months since your RNA vaccine or 2 months since your J&J vaccine, you should get a booster. The advice is now really clear in Colorado. Honestly, I was a little uncomfortable with this advice last week, which said, forget all the risk factors. You live in Colorado, you're 18, you've been enough time since your last dose, get it. It's recommended for everybody now in Colorado. I actually asked Dr. France to talk to CDC because I used to work at CDC and I have a lot of respect for CDC guidance. And the answer I got was, yeah, this is a little gray and what you're doing is a little beyond it, but yeah, we get where you're at. And we're certainly not going to push back on the strategy you've adopted. On the right, of course, is last week's big news, pediatric authorization. We don't yet show pediatric vaccines on our dashboard, although Adam Anderson is going to get that up there in a couple of days. We've had 2,300 doses given. That turns into about 1% of Adams and about 2% of Arapahoe and Douglas 5 to 11-year-old kids at this point. Nationwide, we've seen about 360,000 pediatric doses given. Next slide, please. Modeling. Let's talk for a couple of minutes about what we've been hearing from our modeling team at the School of Public Health. And as the little snipped in headline from today's Denver Post says, we're actually already exceeding what the model suggested just 3 days after the model was published last week. The right-hand graph, or sorry, the left-hand graph looks at hospitalizations, actual hospitalizations up through the present time. And if we stayed on the current trajectory, that's that blue line that goes up and peaks in early December and then comes back down. Or if we have worsening transmission control, and transmission control is more crowding, more indoor spacing, less mask wearing, those things all turn into more transmission happening. And you can see that peak, which is about 1,500 or so if we stayed on the current trajectory, gets up to close to 2,000 with a diminishment of transmission control. The right-hand graph shows the bad transmission control, the 5% worsening, that is getting to close to 2,000. But then it shows what happens if we get pretty good booster uptake in green and even better, 75% by the end of December booster uptake. And what you see is that it doesn't affect the peak that much. Boosters are really important, but boosters are not what's going to turn the curve around. They do have a big help on the downslope. If you look at where we would be in January and you look at where that green line is versus the blue line or the orange line in particular, we end up having a fairly major reduction in hospitalizations. It's just not all that fast. Next slide, please. And this is perhaps a better way of looking at it. The middle three parameters is our current trajectory. The green is slightly increased booster uptake and the orange is 75% increased. And that's without any change in transmission control. If we started controlling transmission better, 5% or 10%, you can see the histograms are lower. I fear we're more likely to move to the right, at least to 5% or so. And then you can see those numbers, even with boosters, by the end of February. This was data that the school pulled together last week. So that's what now is. Now is about the 1st of November and February 8. 8th, you can, or 28th rather, you can see we're talking, tens of thousands of cases, with the best case scenario in that 5% transmission control reduction being about 5,000 less, the 16,985 versus the 21,000. And then of course, if transmission control gets even worse, because we have lots of big gatherings at Thanksgiving and we do a lot of traveling at Thanksgiving, and we come back and have a lot of mixing at Christmas parties, and then we really let things go, back to normal in the holidays, that's when you get into 10 or even higher percent transmission control reduction territory, which is of course way beyond what hospital capacity is. This is when we really begin to go hugely worried about crisis standards of care or even rationing of care. Next slide, please. Finally, let me say a word about mask mandates and mask metrics. This is simply a reminder that we do have some information. The upper right is the graph I showed you from CDC at the last board meeting, and the lower right is the data the state health departments pulled together about the differences in cases among those districts that have school mask requirements and those that don't. We have plenty of evidence in our question and answer tonight. I haven't read all of them, but I get frequent emails from people that feel like mask mandates are not appropriate. Plenty divisive, not just among parents, but also school leaders and elected officials. So we have continued to try to define what we think are meaningful, pronounceable metrics for an exit strategy. What parameters do we need to meet before we think it would be safe to lift these very divisive mandates? Next slide, please. I just want to make note that our colleagues in the American Academy of Pediatrics, who last week, said, hooray, everybody who's eligible in the 5 to 11-year-old group, we think should get a vaccine. But oh, by the way, we still think masking is important for all students older than 2 and all school staff. So they haven't really changed their mask guidance with the advent of vaccines, realizing they're very, very new. Next slide, please. This is really the meat of where we're at. We've probably had, I guess, at least 10 meetings with our local public health official colleagues. We've had 2 or 3 meetings with our school superintendents. We've had several with the state health department. And where we have ended up in what I'm calling our tentative conclusions, and I'll tell you why they're tentative in just a second, is to consider both case rates and vaccination. And for vaccination, considering both a vaccination rate target as well as a duration of 5 to 11 vaccine availability. Those have been probably widely available, I think it's fair to say, since maybe yesterday. Our tentative conclusions are that we would be looking for a community case rate criterion in the CDC moderate zone, less than 50 per 100,000 for 3 weeks, for a intermediately sustained period of time, and one of 2 vaccine criterions. Either school-age kid vaccination rates greater than 70%, or the 5 to 11 vaccine widely available for 3 months. Now, I think it's very unlikely that we would get to the school-age vaccination rate greater than 70% in less than 3 months. So I think that if we get to a case rate less than 50, and on the one hand, we're way above that right now, but less than 50 is not impossible. All 7 counties in the San Francisco Bay Area who devised similar metrics not so long ago are getting very close to 50. Actually, the map I show you on the right, which is pretty hard to see, believe it or not, there are 3,300 counties on that map, color-coded, and most of them are red, which I'll blur together. But very interesting, if you look at the South, Texas, Florida, Mississippi, Alabama, these were poster cases for really terrible situations. Not even 3 months ago. And seasonality is huge. We're getting to the worst of our seasonality, but in Southern Florida, Southern Texas, et cetera, they're in the CDC moderate zone. That yellow is less than 50 cases. Finally, we've had a request by CDPHE. We're in the middle of a crisis right now. Please hold off on finalizing and releasing your final metrics until the hospitalization crisis has stabilized. This is really, I know this is a public meeting and we have members of the public listening in, but I wanted to give the board an update that we are, as a group of Metro directors, prepared to make an announcement as a group, but we're not releasing that yet out of the respect for the state's position about avoiding confusing messaging. I just want to point out, by the way, very interesting article, pasted in the upper right. We need to talk about an off-ramp for masking at school. Even the liberal New York Times is saying that. We get it. We need to have an off-ramp for masking. And that's why we've come to the tentative conclusions that we have. And I would say, by the way, that there's some really good thoughts in this op-ed piece. And what we've used here are very similar to what the experts that they interviewed recommended. Next slide, please. I think we're pretty close to the end. Yeah, this is sort of like the big wrap up. So we're like super nervous about the hospital capacity crunch. The upper right corner is a public health advisory that we released with the other members of the Metro MDPH with the CDPHE. It's the first joint advisory we released with CDPHE. And we made a number of recommendations. Get vaccinated if you haven't, get a booster if you haven't. If you're a 5 to 11, or if you have 5 to 11-year-old kids, please strongly consider them getting vaccinated. Wear masks in public places to protect yourself and protect others. If you are particularly vulnerable, even if you have been boosted, be cautious about going to places where masks are not common, or there may be lots of unvaccinated people. Don't forget your flu shot. And if you get sick, remember there is treatment. And one can find various monoclonal antibody infusion sites online. Those are not perfect, they're clunky, but they reduce hospitalization and death by 70 to 80%. For vaccines, we are not mandating vaccines, as the board well knows, but we are watching and discussing with others. We had a meeting at MDPH with the Metro Mayor Caucus last week, sharing what's happened in Denver with their employee mandates. These were not done, these were done as a sort of a human resource call. And we think that if the OSHA standards for businesses over 100 go into effect in January, and I think you're probably aware those are on hold right now, temporarily with a federal judge order, that our local governments are not covered by OSHA standards. And we think that it could be both a powerful statement by our local governments and frankly, helping to protect their workforce and those that they serve if they could assure vaccination at a much higher level. We're obviously pushing the boosters and the pediatric vaccines. We're still looking to promote safety as best we can in public spaces. We are eagerly awaiting new treatments. I think you're probably aware that both Pfizer and Merck have new, apparently highly effective oral antiviral drugs. They have different mechanisms of action. They are going to be a heck of a lot easier to use for treatment than the monoclonal antibody infusions. And I think they will have the potential, even for vaccine hesitant people or vaccine folks that have not been able to access vaccines, could really be very, very important. They both have got about a 70% hospitalization reduction effectiveness quotient. We continue, I say this every time, we never have our messaging perfect. We know that. We're going to continue to remind ourselves that part of our holy grail is communicating more clearly. We are still trying to come to terms with what's the duration of this high-level pandemic response. When can we off-ramp it? When can we treat COVID like the flu? And then I think the board knows we've obviously had a number of organizational challenges come up in the last couple of months. Douglas in September, Adams in October. We have collaborative planning going on with both counties. I want to name the important fact that this uncertainty is really tough on our staff. And I want to thank our leadership team for taking all the steps they have taken to try to identify ways we can bolster that, because we can't deliver good services if we have demoralized, anxious, uncertain staff, and we want to try to protect them the best we can. Thank you very much. I'm happy to take any questions if there are any, Kaya.
Thank you. Any questions? I just want to say, I know we all appreciate the regular updates that we receive from Adam Anderson. They're very, very helpful, and they make sure that the board really knows as much information as possible about the trends, the disturbing trends. Julie, did you have a question?
Yeah, I do. So I have a couple questions. So John, around staffing. So I feel like staffing has actually been an issue for quite a while. And I mean, I feel like staffing in our hospitals has been stressed now for months. And now with just this new wave of infections and folks coming in, plus people transferring in from, you know, outside the metro area into the metro area hospitals. I'm curious, where is the data around better understanding where our hospitals are with staffing? Has there been talk at the state level about incorporating better data collection around staffing and because that is the true marker that I think we need to track. I mean, I could tell you that, you know, St. Joe's has, you know, 20 ICU beds, but if they don't have staff to staff it, they don't actually have 20 ICU beds. I mean, and the reality of that, I feel like, is getting lost a little bit. I was just kind of curious, from your perspective, where's that data? Is anyone talking about that?
You know, Julie, it's such a fantastic question. I was a local public health director on a work group last summer that created the dial, and the issue about how do we define staffing and should that be one of the parameters we look at came up, and it never really gelled. The GERC, I'm also on the governor's expert emergency epidemic response committee, has taken a stab at trying to define staffing. And I mean, I'm going to ask Michelle to speak up in just a second to see through her lens she's got anything to add. But I think, as I understand it, part of the problem has been staffing is so incredibly fluid, meaning that we can move people from the PICU to an ICU or from this ward to that ward, and we can slow down vacations or ask people. And it's just the best we've come up with are these very qualitative, how does staffing look for you next week? And that's where that number that we get every week, you know, this week's number is 37% of hospitals project a staffing shortage. Michelle, are you aware of any conversations that imagine they have a better way of trying to detail that?
No, I mean, we've talked about it for a long time, as you were saying, John, and we just haven't come up with other metrics that help us articulate and understand that better.
It's such a great question. Okay. I think you've asked it before and we don't have any better answer.
I don't know. Well, I think really what I'm also just trying to hope is that somebody was working on it and going to come up with like a really great idea, but it doesn't seem to have happened yet. Because I just feel like, you know, we are at a crisis in our hospitals today. And so it is really important that, you know, the public realize that. It's so interesting how, you know, if you looked at even, you know, local news like a year ago, I mean, Kyle Clark used to say, this is how many beds we have in the state. You know, it was like a topic of conversation. I'm not hearing that anymore. It's as if people don't really truly know how bad things are. And I don't know how else to really kind of like raise the attention. And I think obviously today the governor's actions really help kind of raise that red flag, but this has been something that has been occurring for months now and is really reaching a boiling point. And so my other final question is actually about boosters. So I'm very excited to hear about what the governor has said about boosters as of today, because I feel like the messaging around boosters has been super kind of gray. It's like, yeah, kind of get it, but yeah, don't kind of get it. And like, so I feel like stronger messaging on that could be helpful. And then I liked what you put in the chat earlier about, you know, really centering vaccine clinics for everybody, right? I mean, you have your kids, you have the adults who need to get boosted. Like, I mean, having that full family kind of wraparound is a huge advantage. I will say personally, I went to the zoo clinic this weekend because I was able to go and get my booster. And so I was able to do two things at once. And that means I didn't need all these extra appointments and running around town and getting these extra shots. I was able to do the whole family at one time, and it was perfect. So I definitely recommend that should be the best way moving forward. And then, working with our school districts. I know I'm in Adams 12, so I've been getting lots of communication from my school district about vaccines and, is there clinics or how to get vaccinated. And so I would love to see, Tri-County be really active in those and really doing the whole wraparound, because as we start messaging boosters harder, it's just so easy for families to get all in one time.
Yeah. So these are really excellent points, Julie. Glad you said yours was at the zoo. Is that right?
Yes, it was at the zoo, and it was a fantastic clinic. I was just so glad that we were able to do everything at once, and the kids did great. So it was perfect.
That's great to hear.
Great. Any other questions? I think this is just a real fast-moving situation. So again, I just really appreciate keeping the board up to date on where things stand and where we appear to be going. So thanks again. Not seeing any hands raised. How about we move to the executive director's report? I'll just say, as usual, Tri-County teams should be applauded for the wide variety of public health programs that are underway, and congratulations to the many Tri-County staff who've been recognized for their award-winning work. So thank you. Any other questions, comments from board members about the executive director's report? Not seeing any. Great, thank you. We'll move now to the other.
Hold on, Kai, I have a.
Oh, sorry. Sometimes I just can't see all the tiles.
No, I was a little late with the hands, so I'm not going to get on that too much. But one of the things that I just wanted to say real quickly is great job on the Tri-County Health Department all-staff meeting. I thought it was just fantastically ran, and I mean, it was just a really. I know that there was a lot of kind of like a gray cloud over the entire event, but I felt like the people who, put it on and the staff who were really behind it, were really positive and talking about and highlighting the great work that everyone's done. And Betty Hart, the guest speaker, was phenomenal. That totally made my day, actually. So I really appreciate all of that hard work. So I just wanted to give a quick shout out to staff for an amazing meeting. Thank you.
Thank you. Thank you, Julie. Moving on to other items, going to set the agenda for the December board meeting. In addition to the regular updates that we have at the end of the year, we'll be nominating our officers for the next year. If there are any other topics that you would like to see included, please let me know. We're very flexible about responding to the interest of the Board of Health. Julie, is your hand still raised?
No, actually, I have an agenda item for next month that for the next meeting to throw in there, and that would actually be overdose and harm reduction focused. And I did email John and staff, and we had a great conversation, but I think it's great to highlight what's going on currently with harm reduction and overdose prevention, as well as naloxone supplies and things like that, and just how it's impacting the metro area. I think could be really helpful.
Great idea. So we'll be most likely scheduling executive sessions to focus specifically on the Tri-County transition work and try to keep you updated on that as developments arise. And again, just stay in touch with me between meetings. Again, we as soon as we finish one meeting, we start planning the next one. So, but there's lots of opportunity for people to weigh in on things that they'd like to discuss. Board member remarks. Are there any board members that would have remarks that they would like to say?
Hey, Kaya, I'm sorry, can I point out also that we will have a public hearing to adopt our fiscal year 2022 budget?
Thank you, Renee. You always keep me honest here. Thanks again. Okay, board member remarks. Not seeing any. I guess I would just like to say November is a month when we take time to give thanks. And during this challenging years, it's really often difficult to see the progress our public health department has made. So, you know, some people ask why more is not being done to control COVID. And there are many who have criticized Tri-County for doing too much. So tonight, I just would like to thank the Tri-County team for what is not often acknowledged. We can't know how many more people would have contracted COVID except for the public health measures that are in place. We can't know how many more people would have been hospitalized, and we certainly can't know how many others would have died. So thank you to the Tri-County team for what you've been able to prevent. We really appreciate your dedicated and often thankless work for always thinking about how to keep the entire community safe. And I'd also like to thank my dedicated fellow board members who are unpaid volunteers and dedicate countless hours to the challenging work that remains in front of us. So thanks to everyone. Okay, so at this point, we need to move into an executive session to discuss legal issues related to Adams County's withdrawal from the Tri-County Health Department. Do I have a motion to move into executive session?
So moved.
Second, is there a second?
Second.
All in favor say aye.
Aye.
Anyone
Aye.
opposed? Anyone opposed? Motion carries. Renee, could you move us into executive session, please? Oh, wait, Sid, I think you need to say something. Don't you need to clarify the legal provisions that
Yes.
allow us? Yes, thank you.
Yes. Yes, we need to cite the Colorado Revised Statute, Section 24-6-402, parentheses 4, close parentheses, which is the open meetings law, which allows us to go into executive session to discuss today areas of para issues and perhaps issues relating to structural formation of Tri-County Health Department.
Great, thank you, Sid. So see you all in the executive session.
Thank you. At this time, I need to ask anybody who is not a Board of Health member or Dr. Douglas or Jennifer Ludwig or our legal counsel to please go ahead and leave the Zoom webinar so that our Board of Health members can move into executive session with their legal counsel. You have the opportunity to go ahead and leave voluntarily. If not, I will remove you from the meeting. And it'll be just another minute or so, Kaya. I am removing folks that have not left voluntarily.
Okay, thank you.